Welcome to the ILCM training course Liver Cancer. My name is Sachen Kautz and I'm part of the operating committee of the International Liver Cancer Movement, ILCM. Today we focus on diagnosis. It's my great pleasure to have Bruno Zangaro with us, an international well-known expert, and Michelle Tully, a UK patient at risk and advocate, who have lots of questions. Let's start. Michelle, your first question to Bruno.
Hello, Bruno. Can liver cancer be diagnosed by blood samples or markers?
Hello, Michelle. The short answer is no. Blood markers are useful for identifying the risk or even the chances that a tumor may be present, but by no way you can make sure that a patient has liver cancer only based on the presence or the levels of any biomarker that you can detect in the blood. You need either imaging or biopsies.
Okay, and that's actually what I was going to ask you about. What are the imaging techniques?
There is a particular situation in liver cancer that makes it different from any other cancer. And this is that in a certain background, it can be diagnosed by imaging. So we diagnose tumors because we take a sample, we put it on the microscope, and the pathologist says, yes, this is a cancer, or no, this is not a cancer. But in liver cancer, when the patient has a liver cirrhosis, as you can see in the slide, you can make a very accurate diagnosis of liver cancer only based on the appearance on CT scan or MRI scan if there are certain features present. In those cases, it is only in the presence of cirrhosis, you can make an accurate diagnosis based only on imaging.
Okay, Bruno, so what is a biopsy?
A biopsy is taking a small fraction, a sample of a tumor and analyze it to see if there are cancer cells there. And the biopsy is the cornerstone of the diagnosis of liver cancer whenever a patient has no cirrhosis, or even sometimes if the patient has cirrhosis, but the imaging features are not absolutely convincing. So in many cases, in particular in these two situations, biopsies are mandatory and patients should request a biopsy to be absolutely confirmed that the diagnosis of liver cancer is strong and stable and accurate.
Okay, thank you. What does surveillance mean?
Surveillance means that because you know the population that is at risk of developing liver cancer, you can do things to detect those tumors at an early stage where the chances of getting cure are highest. You can see in the slide that it takes a long time from the time a cell is transformed into malignant to the time that disease is detectable, and in a patient that would be as asymptomatic, to later on when the symptoms will appear and unfortunately untreated when the patient will die from liver cancer. So there is a window when the disease is detectable before the patient gets symptoms where you can screen the patients, and we do this with ultrasound examinations every 6 months to identify really small early tumors that can be cured.
I have to thank you both. Great. So thank you so much. And if you, dear audience, are interested to learn more about liver cancer, please go to www.ilcm.global. See you soon.